training different levels of caregivers requires different types of approaches and different type of educational workshops. Training a physician who might not be involved in a harm event for the vast majority of their career, hopefully never in their career, is quite different than training safety, quality, and risk managers who do these types of conversations and have to deal with these types of events more regularly. Training for residents, on the other hand, is completely different. They're the next generation. They need to know the importance of open and honest and effective communication at some of the most difficult times we have as care providers. Our goal is to try to take them, as we like to say, from unconsciously incompetent to consciously incompetent, from I could do this, this is easy, to whoa, this is very difficult. I need to reach out to others who have an experience and have a knowledge in how to do this, and to help guide me if and when I would ever have to have a conversation like this. A good analogy on that unconsciously incompetent to consciously incompetent is I look at my children when they were first learning to drive a car. My son, when he turned 16, was saying, "What's so difficult about this? It's got 2 pedals, 1 steering wheel. I could jump in and drive this car tomorrow without any training." Yet the moment they get behind the wheel, they realize that there's a lot more than they realize. There are other cars on the road. There are stop signs and pedestrians, and all of a sudden they start saying, whoa, this is more challenging than I realized. I do need this driver's education. I do need to learn more about the nuances of driving than I originally thought. When somebody has come to us, somebody has put their care in our hands, and we have unintentionally caused harm, good people trying to do the best, yet our systems and processes resulted in patient harm through a medical error, patients and families are first physically harmed, but you lose trust. They're wondering what happened and how could this happen at such a great institute. They thought we were providing great care. It is so important to try to maintain that trust, and we've learned through the years from doing it the wrong way and totally destroying that trust, is that if you reach out to patients and families, you have these meaningful conversations, you engage with them early, and you continue to have open and honest conversations with them about what happened, answering their questions in an open and honest way, and when appropriate, apologizing for it, you can maintain trust. And those patients and families, while still maybe not happy about that particular care that had occurred, will stay with you, will stay your patients, will come back to your institutions. And in many cases, we've seen these patients and family members become part of our safety, quality, and risk management teams. They will join committees to try to help us improve our care because they understand we're trying to make care the best it can be. And so that ability to maintain trust is our ultimate goal when we do this type of work.